Doctors of Reddit, what was the dumbest patient you've ever had? Why? I'm not a doctor, I work in the but a patient's complaint was that she had seasonal diabetes. Yes. Seasonal diabetes. Or as I like to call it, the holidays. When I don't want to stop eating candy. During my husband's intern year, a heroin addict brought in her infant son to the because literal ducking rats had been eating the baby. He was alive. Barely, but had several wounds. The most damaging being the rats had eaten his penis and testes. She just asked when will it grow back. The child was released into state care and she was arrested. Dude eats a snail off the ground for $10. Gets sick. Doesn't get seen for 4 days, ends up being sepsis. Comes to the hospital in a wheelchair because he's paralyzed due to the infection. Had a little boy with very little intestine left after many surgeries had removed dead or non-functioning bowel, so he could not eat by mouth or stool out of his rectum. He was fed a high-calorie, highly nutritious formula through a tube in his stomach, which then went through for absorption, ending into his ileostomy bag. As you can imagine, it was very hard for his body to retain calories nor nutrients, so his growth and development were very behind. One day he is brought into the by mom because he is dumping too much liquid stool into his bag. He was brought in on a gurney, holding a bag of Cheetos and drinking Pepsi in a baby bottle. I don't have diabetes. I take medicine for that. Happens so often I can't put a face to that quote. I've told this story before, but I had a patient that got a pretty nasty infection and became septic after putting collard greens in her vagina for several days because she thought it would induce an abortion. Not a doctor, but EMT, had a woman who was in active labor despite insisting she couldn't be pregnant. She said her last period was like 10 months ago, so she'd gone through menopause. She was 25. Doc here. I had a guy with an ICD in place. For those who don't know, it basically shocks your heart if it goes into a funny rhythm. He would regularly come into the hospital to have it turned off because he would do a ton of cocaine and the thing would keep firing due to his high heart rate. I told him not to do cocaine. He kept doing cocaine. Holy shit. I knew a guy back in the 90s who loved cocaine. He was in his 50s and had gone from doing rails to freebasing. No shit. He did coke every single day of his life. He already had 2 heart attacks, and when I asked him about his coke use, he told me he thought it was a good way to exercise his heart. Don't know what happened to him. I assume he's dead. Female patient presented to the emergency department with severe vaginal pain. The patient informed the nurse she had wanted to get one of those IUDs, so she couldn't get pregnant, but couldn't afford it. So she did the next best thing. She put superglue into her vagina and tried to seal off her cervix. Oddly enough, it was causing significant irritation. Not a doctor, but I work in a doctor's office as a mower, specifically pediatrics. A secretary buzzes back to me that there's a call online to that needs medical advice. I pick it up, and one of our patient's mother is on the phone having a panic attack. She is hyperventilating into the phone. I asked her if she was alright, thinking maybe she needed an ambulance, and through her breaths and now tears, she starts telling me that she thinks her 4-year-old son has a skull fracture. I ask if he fell. No. I ask if he's conscious. Yes. I ask if he's breathing. Yes. I ask if he is bleeding from his ears, eyes, nose, mouth, scalp. No. I ask if there is any visible wound. No. I ask why she thinks he fractured his skull. Because underneath his eyes is red and puffy and Google says that's a skull fracture. I tell her to go to the for proper assessment. We don't do MRIs, X-rays, CT scans. She doesn't want to. She says she was supposed to take her kids to the beach. Mind you, she is still crying and breathing heavy at this point. I tell her to come right over then, but warned her we would probably have to send her to the She shows up 15 minutes later, cradling the child and crying. The little boy was crying too, and screaming, "I don't want to die, mommy." She kept hushing him and saying mommy loves her strong boy, no matter what, which only made him cry harder. I pull her back into the room and she just dissolves as she tells me how she looked at him in horror this morning and saw the guarantee signs of a skull fracture. She swears he must have hit his head yesterday at swim practice. The little boy is crying hard, but I can see the noticeable swelling and pinkness under the eyes that she was referring to. I went to get the doctor and told her what I thought. She went in, came out about 10 minutes later shaking her head. She had the same diagnosis. You know when you wipe your eyes after swimming, you usually wipe under your eye too. The kid must have wiped off his sunscreen around his eyes the day before. All the pinkness and puffiness was from a mild sunburn under his eyes. Not me, but my mother. One time someone came to her worried that there was a bump on his wrist. It was the joint. Had a patient who was coming back post lap band for a checkup. What we usually do is revise the patient's weight, etc, and tighten the band or loosen it as needed. Now the thing to remember is that getting lap band isn't as easy as just throwing down some money. For 6 months, the patient must meet with a psychiatrist and a dietitian to understand what they are getting into and if they can adjust their lifestyles and commit. A goal weight loss target, X, lose 10 pounds, is usually set for the end of the 6 months to ensure the patient is serious. So after all of this rigorous evaluation, a patient is deemed fit for an operation. Enter my patient Sylvia. I checked her chart. BMI before surgery was 40. She was morbidly obese and now had come in for her first follow-up to ascertain if she'd lost any weight. Well, I put her on the scale, calculate, and what do I see? Her BMI was now 45. Perplexed, I asked her to explain her diet to me. Sylvia, well, I've been doing a liquid diet just like you all said. Me, very good. Can you maybe what you have? Sylvia, I make smoothies and have them whenever I feel hungry. Me, so what do you put in your smoothies? Sylvia, cake and ice cream. Me, yup. She was serious. Somehow it didn't occur to her that this wouldn't be healthy. We reversed her band. TL. Doctor, patient on lap band gains weight having ice cream and cake shakes. An older lady was brought into the ED barely conscious by her husband. In a very thick Italian accent she told the doctor she was dying. She had complained of feeling tingly and having a dry mouth prior to passing out. The doctor sat the husband down and they did a history. No serious medical problems and she was very fit. In fact, she spent the morning cleaning her son's bar, as she often did on a Sunday morning. Considering her age, they took these symptoms very seriously and begun running tests to find the source of her ailments. The son came in to visit his mother, and on the way he bypassed his bar. He noticed that his mother had helped herself to some of the treats prepared the night before. The son, the apple of his parents' eye, had to then explain to his father and the doctor that the treats she had enjoyed were space cakes, and apparently she really enjoyed them as she ate quite a few. They then had to sit down and tell this elderly lady that she was not dying and that she was in fact stoned. Fortunately, she was still high enough to see the humor. TL. Doctor, elderly lady was convinced she was dying, but later found out she was just stoned. Nurse here. Recently had a patient's wife claim to be a retired nurse. While we were teaching her how to do an in and out catheter on her husband, she asked which hole the pee came out of and which hole the semen came out of. Dentist here. In school I had a 70 years old part who was still in the dating game and looked like that old lady who just died who played the genie. I was thinking of Joan Rivers. She's got a ton of acid erosion on her teeth. Tells me she drinks on 3-0 water. Didn't know what was in it. We look it up on Google. That'd be a pH of 3. All of her water. Plus, she likes to put lemons in her water. I tell her this is also acidic. She tells me I'm wrong, because her friend who took a few nutrition classes said that as soon as the lemon juice gets into the body, it turns basic. I told her I had a biochemistry degree, and that was wrong. Also, her blood pressure is super high every visit. She tells me that she stopped taking her BP meds because she thought they were unhealthy. I tell her that the method is not working at all. A few weeks later, she strokes out and never gets out of a wheelchair again. I'm friends her on Facebook now. It's just sad. I saw a man in his 30s who took cocotamol, paracetamol plus codeine to get his opiate fix. He had been doing so for 3 days. He presented in acute liver failure, horrendous pain, and died later that week. Please follow the instructions on paracetamol, acetaminophen for those over the pond. They are not sweets. I'm a medical student, but the number of patients I've seen who refuse to take medicine because they don't want chemicals inside them is staggering. Patient came in with a rash around her mouth. She was going on about how she had it 14 years ago, and the dermatologist prescribed a certain antibiotic to cure it, and diagnosed her with perioral dermatitis. She's showing us pictures on Google. Okay. Doctor diagnoses her with impetigo, and prescribes her an antibiotic ointment. She leaves and fills the prescription, and comes back flipping her shit. She googled impetigo and, with the help of WebMD, came to the conclusion that it was a children's disorder on the arms and legs that can only be contracted from children, and she wasn't around children. Insists that what she believes she has, perioral dermatitis, is a woman's disorder and she doesn't have this children's disease. Says that the antibiotic he prescribed isn't on the list of treatments. Thanks, WebMD. It's on the top of the list actually, of actual medical books. But whatever. Whole time, she's showing us these pics off Google of perioral dermatitis saying it's a woman's disorder. Half the pictures were of men. Now one thing you should know. Perioral dermatitis means rash around the mouth. That's it. It doesn't mean shit. It's not a type of rash. It's not only cured by a specific antibiotic. It's just a rash that happens to be around the mouth. She was furious, shaking with rage and about to start throwing shit. We see the doctor wouldn't prescribe her this certain antibiotic. Doctor told us to call the cops if she came back. People are crazy. I'm a postpartum nurse. This isn't so much weird as sad, but I've never forgotten it. I had a patient ask me, "Do you ever feel like everyone is watching you and judging you?" I told her yes. I suppose everyone feels that way sometimes. Then she said, "And when you feel that way, don't you just need a little cocaine?" To which I answered no, while thinking if I did, would I tell you? Also, she kept fiddling with her plain fluid forth to make it run faster. I'm pretty sure she thought there was something in it. I had to put it on a pump. The people judging her were her parents, who had custody of her children, because she was engaged to a man who molested one of them. After I found that out, I kind of judged her, too. A lot of patients come to the hospital because they are sick but refuse to do any tests or take any medicine. Do people expect healthcare workers to do a ritual dance and chant around them and magically heal their illnesses? I got a phone call late at night through the answering service. This is somebody, a pharmacist at the Walgreens on D Street. Sorry to bother you, but a quick question. How do you spell 40? Me, half awake. 40? That's what I thought. We have a person filling a script for 40 pills. We'll take care of this. I write opioid prescriptions that last a day or so for patients unknown to me until they see their primary care physician. I work as a receptionist/office assistant at a large clinic, so I'm obviously not a doctor, but I do deal with a lot of patients. I haven't been doing it for very long, but I have a couple interactions that come to mind. One was a lady wanting to know if our clinic would do a virginity test on her because her PCP told her they don't do that. It took me way too long to explain it's not a real thing. Another lady needed to get tested for STDs. Not weird, but she said she needed us to send the results to her prospective employer. Why? We told her we wouldn't do that, but she could come get a copy of her results and do whatever she wanted with it. She does, but comes back later the same day and says we gave her the wrong test results. We double check. Nope, those are definition her test results. Trying to sort this out with her, I asked her why her employers would want an STD test anyway. She said it's to make sure she doesn't have tubulars. Then it dawned on me. She meant tuberculosis. She needed a TB test, not an STD test. She gets angry and yells that we are just trying to trick her into taking more tests so we can charge her more. Then she stormed out. I don't have to deal with patients, but I helped out a vet for a while, and there's a lot of dumb pet owners. Had one lady who was really concerned about her obese lab getting hiccups. The vet let her know the dog was overweight, and she told him he was wrong, and then insisted we do diagnostic tests to figure out the hiccups. patient in neuro IQ after a subarachnoid hemorrhage. Dealing meth out of his room. A dumb idea, but the execution was actually kind of impressive tbh. Another patient was in the hospital to have her 9th baby and then give it up for adoption. She was 949 on adopting out babies. She was 34. Had a BMI of 65. No teeth. A creepy partner. I think it was a feeding fetish type relationship. And no pain tolerance. I was asked to do an epidural. As I'm going through the consent, she's distracted by some zombie pseudo documentary that she refused to turn off. She had brought the entire DVD set to watch during labor. At the end of the consent process, I asked if she had any questions. She just wanted to know when can I go smoke a cigarette. I told her after the baby was out she could do whatever she wanted. The adoptive parents, who already had a few of her offspring, were there the entire time. I had to forcefully ask them to leave for the sterile epidural placement, which was remarkably easy given her size, but a little more challenging given the distracting zombie show that she refused to let us turn off. Baby slid out about 30 minutes later, and she was discharged before the end of the day. I think the OBS at least managed to get an IUD into her. I'm a student and my GP supervisor was involved in a scheme to reduce R&D waiting times by having a GP in R&D to take patients that weren't actually in an accident or an emergency. As none of the patients were actually dangerously ill, I was basically doing the consultations with the doctor supervising, double checking and signing prescriptions, etc. A guy in his late 20s walks in, looking very healthy, and sits down. I was stung by a bee this morning. Okay. Where? On my cheek. There's no swelling or anything visible. How long ago was this? Well, it took me about half an hour to get here, and then I've been waiting another 3.5 hours. I wonder why. Did it stop you swallowing or breathing? No. Are you allergic? No. What would you like us to do? Check I'm okay. At this point I turn around to my supervisor attempting to say WTF do I do here? He says you're okay. Go home. Apostrophe. It was the most surreal consultation I've ever had. Not stupid. Actually kind of sad. My friend told me that she met a man on her oncology rotation who had lung cancer and who was convinced that some chlorophyll drink his wife was making him could help him photosynthesize, make oxygen and breathe better. Please subscribe and leave a like if you enjoyed this video and if you want to see more of Reddit universe.